Hello, this is a slice of the lung tissue with the associated pleura and some attached chest wall. We can just make out some ribs here which have been sectioned. The obvious abnormality is actually within the pleura, and we can see that the pleura is markedly thickened in many areas, almost resembling a rind around the lung. Which is encasing the lung. Over here it is quite nodular as well. It's very fleshy on the cut surface. You can see here there is nodularity and a very kind of fish flesh appearance of a pale tan tumor. In some areas we can appreciate that this tumor seems to be infiltrating into the lung parenchyma because the interface between this mass here and the lung parenchyma is kind of indistinct or blurred. So there is likely to be some invasion into lung parenchyma here. Let's just follow the rest of the specimen. You can see that there's a nodular area here and possibly some necrosis with these paler geographic areas. I'm outlining one here. And as we move down again, we see this nodularity. And over here, there is a thicker area of tumor. And in this area of tumor, I can see that there is invasion likely into the intercostal tissue, soft tissue, or the muscles. And this comes very, very close to the rib. So we should section this area to view under microscopy to see whether there is direct invasion into the bone of the rib. This is the classical appearance of malignant mesothelioma. This is a tumor that arises from the mesothelial cells, and it can be from the visceral pleura or the parietal pleura, and it is often associated with occupational exposure to asbestos. So patients who worked in the mining industries, and there's a long latency period, usually more than 20 years, they may develop pleural fibrosis, pleural plaques, and then with the increased risk of development of malignant mesothelioma. Usually the prognosis of this tumor is quite poor. It is actually very difficult to treat surgically. And this tumor can spread to the hilar lymph nodes and also spread distantly. For example, it can metastasize to the liver. So not everyone who works in the asbestos industry will develop a malignant mesothelioma. And also there are cases of malignant mesothelioma without known exposure to asbestos. The other important thing to note is that asbestos exposure also increases the risk of lung carcinoma. So not only malignant mesothelioma, but also lung carcinoma. So in summary, we have here a markedly thickened pleura in some areas with nodular thickening, and in some areas suggestive of invasion into the lung parenchyma, and also in other areas forming larger masses that appears to be adherent and possibly invading into the adjacent chest wall. And this is the classical appearance of malignant mesothelioma. These cases are often associated with pleural effusions, very large or massive pleural effusions. If a sample of the pleural fluid is taken, we would see malignant cells. And here is what the malignant cells would look like. They can form clusters floating in the fluid. You can see very prominent nucleoli here. Or they can occur as single cells, some of them even having two nuclei, again with very prominent nucleoli. They can be diagnosed more definitively on pleural biopsy. And here is an example of a pleural biopsy of a case of malignant mesothelioma. You can see these abnormal cells. Sometimes they form gland-like structures, and I'm just outlining the abnormal cells here. And we need to use special markers like immunohistochemical markers to differentiate between malignant mesothelioma and adenocarcinoma.